of your winter woes. Let's see, flu season and 2 other illnesses you need to know about because it is that time of year. Dr. Ken Redcross is here. He's an internal medicine and concierge doctor.
Physician.
Yes, I like saying it that way. Good to see you here.
Thank you for having me on again. I'll use any excuse to come to Arizona.
Oh, we appreciate it. So let's talk about the flu because it can lead to millions of different illnesses that people need to really be aware of.
No, it really can. In fact, the CDC says that each and every year that the flu results in over 35 million illnesses. So it's something that we really need to think about each and every year. But to be quite honest, I think the best thing is to make sure that we are preparing ahead of time, right?
Right.
Because the best defense is to have an even better offense.
Now, even though we're already in the season, we can still take those preventative measures.
Oh my gosh, this is the time to really do that. And it's difficult here in Arizona because the weather's so nice.
Right.
Me flying in from New York, it's freezing and we're already there. So now, even though we're in Arizona, the flu comes here too, guys. So let's talk about some things that we should do along the way.
All right, perfect.
So as we're talking about the flu, we're all very familiar with the symptoms, the body aches, the fevers, the chills, but it's also that dreaded complication of pneumonia that we want to avoid because that leads to so many deaths.
That's when it gets dangerous.
That's when it gets extremely dangerous. Now, the flu season we know is from October all the way out to May. So the winter time is the time to think about it. But even in the summer, you can't let your hair down yet until until June at least.
All right, so what do you suggest that people can do if they haven't already had it? Maybe they've had their flu shot, maybe they haven't. There's still some things you can do.
Well, some seasonal solutions. Number one, there was a new study in a journal called Cell, and it showed that a modified fish oil in animal models actually had some activity against the flu. So therefore, I always talk to patients about more holistic ways of healing. So fish oil is something you may want to consider. But there's also a low-cost homeopathic remedy called oscillococcinum. Now, oscillococcinum is fascinating because it helps not only decrease the severity and the duration of flu-like symptoms, but it's also mobile. It's easy. It doesn't require any water or a pill, and especially that's important as we're all traveling for the holiday season.
Is that over the counter?
It absolutely is over the counter, and the other good thing, it's non-drowsy and there's no drug-to-drug interaction.
Okay, so do you take that when you have the flu or before you have the flu?
You take it when you have flu-like symptoms.
Okay.
It's important. So the other thing we should think about too is whether we get the flu shot or not. Always very controversial. This year's flu shot looks like it's good, and it's important because it looks as if the flu is going to be a little more aggressive. The first strain started out in Australia almost in September, so that's early. So we want to make sure we're okay. But we're not only talking about the flu, we're also talking...
No, because I think people get confused between the flu and the common cold, and people are getting the common cold too. So
Exactly.
what's the difference?
Well, the difference is that, think about the common cold, guys, it's more upper respiratory. So runny nose, stuffy nose, a little more of a headache, sometimes some chest congestion, but the point is it's a lot more mild. It's also causes by different viruses, the echo virus, the adenovirus, totally different. The other thing is coming to your doctor's office. Let's get the flu test, see which one it is as well, because whenever you're managing the flu, you want to make sure that you get on it early.
So what are some remedies that you suggest? Excuse me. What do you suggest that people do to treat the cold?
So one of the things you can do is you can just get a nasal saline rinse. That does wonders as far as to help clean you out. There's also the neti pot. Some people have a hard time. I know. I knew you were going to say that. Some people have a challenge with the neti pot, but very, very effective. And last but not least,
if you can master it.
If you can master it, and that's the best way to say it.
All right. What about that winter sore throat?
We have the sore throats, which are very common and can be quite debilitating for a lot of us. And so I once again wanted to stay a little closer to the earth, kind of to mom's remedies. One of the best ones is actually honey. Honey with a little bit of warm water and lemon is huge because honey is antibacterial, and it also has an osmotic effect, meaning that it pulls fluid out of swollen tissue that's in our throat. So it's a big deal. The other thing we have here is good old apple cider vinegar. I'm starting to feel, I know, but I'm telling you, if you use apple cider vinegar with, once again, a little bit of warm water, very beneficial if you gargle with it, actually. It makes a toxic environment for the bacteria and the viruses in the throat, so it's a good thing. And then I have my cell phone over there. That cell phone
I thought you just left that
I know, you thought I had to answer a call. The cell phone is there to remind us that when we're having a sore throat, this is not the time to talk, because you need to rest your voice, you need to rest your, actually, the muscles around the throat as well. And this is the only time you'll probably hear me say that texting, because I think we don't do enough talking these days.
Just not when you're driving.
Just not when you're driving.
And not even when you're walking.
No, not at all.
These are great tips, and obviously you know your stuff, so we appreciate you being here. The website for Dr. Redcross is drredcross.com. Thank you so much. Here's to a healthy holiday season.
Absolutely. Stay healthy, everyone.
Thanks for being here.